Good afternoon, everyone. I hope I am audible.
Now, Sanchita, can you please check? I'm audible?
Yes, you are.
Yeah. Yeah.
Yes, sir. Yes, you are audible, Simran.
Good afternoon, everyone. I am Good Singh, Program Associates Fair India. Thank you for joining us today. Welcome to this important webinar on WASH and epidemic, preventing waterborne outbursts during monsoon floods. We are here to talk about how we can stop diseases like thyroid, diarrhea during floods and especially in rainy season. Today we will learn from expert about how we can clean water, sanitization and hygiene can help protect people during floods. Without taking much more time, I would like to invite moderator of the day, Mr. V.R. Raman sir. Mr. V.R. Raman sir is a senior development and policy expert with 30-year experience in health, wash, nutrition, and climate resilience. He is currently the national convener of Public Health Resource Network. Uh, I kindly request you, sir, please introduce our speaker and start the session. Over to you, sir. Thank you so much.
Thank you, Luxara.
Thank you.
So the topic is something very relevant for the time. Although in some states the monsoon is already over and it has shifted to the other sides of India, and in some places it's about to begin. But the floods, including flash floods and the other kinds of floods, are there already in many parts of the country, and it can be expected in more. So we have three speakers, from three different organizations. Uh, so we have the three organizations which are represented in this webinar today is Save the Children, Bal Raksha Bharat, and Child Fund India, and also the World Being India. Three organizations are representing today through very efficient individuals who has led very important kind of work across the not only wash sector but the other sectors as well. So this interlinkages and multi-sectorality can also be brought in by these people. So let me very quickly introduce all our speakers before I call them for you know. So first of all, let me introduce Kaushiki Banerjee. I'll come to the first speaker last, uh, so that I can invite the first speaker immediately. So Kaushiki, she is a public health and water expert, and almost 15 years she is there in the field, working on strategy, program management, system strengthening, and in addition to what she has also worked on health, climate resilience, and so on and so forth. She's currently the deputy director of Wellbeing India, and she has been with UNICEF for a long time in India, Libya, and Uzbekistan. And she has a public health degree from the LSHTM, London School of Hygiene and Tropical Medicine. And she has been a Jeroen Ensik Memorial Scholar as well. And her work on equity, gender transformation, community-led solution, all are quite rooted, and she has been teaching in the Harvard University as well. So Kaushiki, welcome to this webinar, and I'll be calling you later. The second person whom I am introducing, the speaker I am introducing, is Poonam Mishra. Poonam is a senior specialist for the climate action and disaster risk management with the Child Fund India. And her expertise, as her title suggests, it is on climate action, disaster risk reduction, and resilience building. And as the senior specialist in Child Fund India, she leads several impactful programs to strengthen community level preparedness and for promoting climate adaptive solutions. And her focus is on WASH, ecosystem based disaster risk resilience and sustainable development. And in her portfolio, she worked closely with governments, NGOs, grassroots partners, and also leads project management, capacity building, policy advocacy, and outcome driven and impact driven initiatives. And vulnerable communities, working with them and empowering the vulnerable communities is her passion. And the first speaker today, Poonam, welcome to you. And I'll call you after the first speaker. The first speaker today is Mirza Tausif Beg, and he works with the Save the Children, Bal Raksha Bharat. And over 20 years, he has been working in the field, and he's currently a program manager. And he leads several multi-state projects. And the focus is on multiple areas like the maternal and child health, nutrition, WASH, uh, and grassroots level action. He's trying to link them with evidence to policy change. And he's known for his expertise in the project leadership, partnerships, monitoring, and delivers impactful outcome for the vulnerable communities. So all the three speakers here, they have some closeness to equity and inclusion. So it will be very useful for us. So Mirza is also a strategic thinker and innovator, and he also, is expert in resource mobilization. So Mirza, welcome to this webinar, and I would like to start with your points, and then we'll go to Poonam, and then we will enter. The third speaker will be Kaushiki. So over to you, Mirza, please. So each of the speaker, I would request, at max, 15 minutes will be the time that you can take, so that questions and discussions can take place with proper time. So within 15 minutes time, please stop the uh, if there is a presentation, or if you are speaking, 15 minutes time please take, and I'll give almost before 2 minutes, I'll give a signal. Yeah, over to you, Mirza.
Yeah, thanks. Thanks a lot. Very good afternoon to all. I hope I am perfectly audible and visible.
Yes, you are.
Thank you. Thank you. So first of all, thank you so much, Sphere India, Ramanji, and everybody for this opportunity. And it's indeed, the topic today where we all are discussing has a great relevance and importance. So, without wasting much of a time, as the allotted time is 10 to 15 minutes, I'll quickly come on the topic. So, topic that is assigned to me is strengthening WASH infrastructure for emergency response and disease prevention. Just give me a minute. I'll share the screen. I have prepared a very brief PPT to let everybody understand about this broader concept. So just give me a minute so I can share the screen. So please let me know if the screen is visible.
It is coming up. Yeah, has not yet
Yeah.
started to show. Yes, now it is.
Yeah. So I hope my presentation
Yeah,
is
yeah. Now,
visible
now,
to
now it
all.
is visible. If you can
Thank
put
you.
it on full screen, that will
So
be useful.
I'll put it in the slideshow.
Yes. Yeah.
Yeah.
It is
Thank you.
visible now.
Thank you. Thank you. Thank you. Thank you. Thanks a lot. So I'm starting at 3:15 and will complete in next 10 minutes. So thank you so much once again. So now this is very important and critical to understand the WASH infrastructure for emergency response and disease prevention. Now, first of all, you need to understand the roadmap of the session, the broader roadmap of the session, where we'd like to, update you about the understanding wash risk in flood-prone context, designing resilient wash infrastructure. Then there is pre-monsoon preparedness and stockpiling, which is very, very important and essential. Coordinated emergency wash response, certain innovations and decentralized solutions, and then aligning wash with humanitarian plan, which is very, very important when you talk about the preparedness in emergency. It's very important that the themes, especially the wash, need to be aligned with the humanitarian plans. So we'll also have a brief discussion on that. So, now, first of all, it's very, very important to understand wash risk in flood-prone areas, as you can see with this slide. So here, if you see that there is this emphasis in terms of the vulnerability, which lies in the fact of contamination of water, of course, as a result of which there are diarrheal and other vector-borne diseases. Then, of course, there is this inundated toilets, which basically means that the toilets which are overflow, and then there's always a risk of open defecation and of course environmental pollution. And then blocked or collapsed drainage system, completely drainage system was completely blocked, and it was badly distorted the times of disasters. And then there is disrupted supply chain for hygiene items and chemicals. So these are some of the potential risks that are there in a flood prone areas, which are very important to anticipate, and accordingly, based on this anticipation, you can plan out a larger strategy to mitigate those areas and those risks. Moving on. Yeah. Now, this slide is very important, and I humbly request all esteemed colleagues and friends to have a focus on that. Principles of resilient wash design. Now, this is very, very important to understand. I have put in, in a broader four categories. So basically, these broader categories, if you see, there are four important things where things move. So the first point, I would like to each one of you to remember certain words. There are four keywords: elevation, then there is a material durability, backup, and community participation and adaptability, which basically is very, very important when you talk about the principles of resilient wash design. At the time of crisis, at the time of emergencies, these principles, they played a very vital role to build up the infrastructure which was completely lost as a result of the disaster. So these are the four important points: elevation, then there's a material durability, then backup access, and of course designs, which basically helps the community adaptability and how better the community can able to adapt it so that the immediate support can be provided. Moving on. Then this water supply. Now this is very, very critical and important. Now at the time of those emergencies, floods, and the crisis, water supply get distorted, And there is a need and requirement to ensure that how this water supply can become functional and what best possible solutions we can have. So based on that, there are four points, things that I would like to share with you. Then there's a first raised boreholes platform, protected wellheads, sealed elevated storage tanks. Then there's a gravity fed pipes schemes, which reduces the reliance on power. And then there's a redundant power. So there should be, in terms of redundant power, there should be a backup in terms of solar panels, solar hands, solar pumps, to provide that kind of backup, which is important. So now, of course, ensuring that there is a functional water supply is one of the key requirements, especially at the time of the emergencies and those kind of crises. As discussed, so a design is there, everything is there in the website and the portal. But depending upon the time, I'll just try to explain the importance of few of the things that are important. This is elevated hand pump. If you can see, on left hand there's a design, and then on the right hand there's this specifications, the visual overview, best practices, and the case studies. So you can see this elevated hand pump is so very important. It is built around 3 to 8 feet above the flood levels with stairs and ramps, and it's often circulated for the stability, and it helps in withstand flood pressure. You know, here a galvanized steel or a concrete aprons were used from a height of 1 meter to 3 meter diameters, and it basically reduces the scoring. It's also include certain hand washing stations just to improve the hygiene. And if you see the websites and other details, it has been well used in Uttar Pradesh and also in some parts of Assam and Nepal, where you find the examples, and the same has already been shared in the WaterAid website. So this is one of the innovations that can be used at that time. Then of course, now in terms of sanitation, keeping toilets safe and accessible is so very important, which requires to raise the latrines or urine diverting dry toilets, UDTS. Then reinforce superstructures, vent pipes. There should be a need of watertight septic tanks, which will have that inspection ports. And then there's the rapid deploy trenches or the container based toilets, which are so very important, especially when the community is living in the relief camps. So this is we can do in terms of the sanitation and keeping toilets safe, clean, and accessible. Moving ahead, so this is one of the twin pit flood resilient toilet. You can have a diagram and the depictions on the right hand side, the illustration. So basically this is a very well approved design, and it really basically helps to have a dual pit, so it allows waste to decompose while the one pit is there which can be used. So it's a simultaneously works at the both the pits. Basically, this raised plinth and the pit elevation helps which control the inflows, and then is slope floors and proper venting prevents the backflow. Its benefit is safe contaminant during flood, and of course the biggest factor is that is it reduces the risk of disease considerably. Well approved, and of course it has low cost and low energy, and it helps to decompose the human waste very rapidly. Now then we talks about the smart drainage for disease prevention. Now drainage, of course, becomes so very important in terms of the disease prevention. So there should be proper site grading. Then there should be lined open drains with debris screens, then regular desilting schedules, and then the community clean drives, which is so very important to ensure the community participation. And basis on that, proper action can be taken. So this is also, I'm not going into the detail. This is also an illustration of dry and wet floor proof drain This is how it is built. It basically a sealed construction where there should be no water entry, and the intentional openings, they are reduced to the structural stress. Basically they are dry and they resist water entry via various barriers. The wet portion allows controlled water passage and it reduces the pressure, and of course often like cheaper, and according to the needs required some kind of cleanups. It basically applied dry methods of toilet to slab and walls, and will wet design will pump up house for storage sheds. So this is one of the methods that is well adopted and used. If you want to study more on that, things are available in the website, so you can go through it. Now this is very very important. Preparedness is so very important. See, because it's important that we need to be well prepared, and pre-monsoon stockpiling is so very important. Sorry, pre-monsoon stockpiling is so very important and essential, which basically helps us to anticipate and better prepared, which includes, you can see, 4 5 critical points: water purification tablets, then this capable water tanks and jerry cans. These are very also very important. Then family hygiene kit, spare pumps, and then piped skim system, and then those are the PPE kits and test kits for rapid assessment of water quality. This is so very important. So this monsoon, pre-monsoon stop clean essentials are very very important as a part of our preparation. Then of course interagency coordination and framework. So
I
interagency
think we need
coordination.
to.
Yes sir, I'm just finishing and
Ah,
I'm coming
okay.
up the last slide. So the
Okay.
interagency coordination framework is so very important. As you all are aware, coordination plays a very vital role. Until and unless there is a coordination and convergence within the agency and then with the external stakeholders, then only a corrective action can be made, which starts the activation of the wash cluster or certain groups, clarity of roles and responsibilities of the government and NGOs, and then there's a shared assessment tools for data collection, and of course then there should be a cohesive efforts for joint logistic hubs and resource map, and then certain actions are required to review the things, and then accordingly what are the lesson learned so that the corrective actions can be made. Now, this is in terms of the last slide, innovations for rapid wash deployment. You can have mobile water purifications, you can decentralize solar power treatment kiosks, you can have modular hand washing stations, then there's a sensor real time water quality, and then there's a cash voucher assistance for household repairs. So these kind of innovations we can propose and share with the community depending upon the needs and demands of the community. And then of course lastly you talk about the integrating wash into the emergency plan. This is so very important. Whatever be the emergency plan, the proper integration of the wash component is so very important, because I repeatedly keep on saying that in terms of when there is a disaster, when there is an emergency, the wash component plays a very vital role. On one hand, the rehabilitation is happening by providing life saving support, but then this wash mitigation and this wash emergency plan has to be embedded so that other requirements can be fulfilled, which include the pre-agreed SOPs, community led mapping and triggering, early warnings, funding, surge staff rosters, and then monitoring dashboards, and of course the decision makings. So lastly, there's a need for call to action, where you need to train the crews and the community volunteers, pilot innovation, ensure coordination, ensure that there should be proper budget provision, and of course then there is a need for the existing audit of the wash assets, so, which is so very important just to understand the things, and then accordingly corrective actions can be taken. So this is it from my end. Apologies for being late for 2 minutes. So these are the few of the phrases you can see, which talks about the importance of this wash in emergencies. Hygiene is two-thirds of health. Disaster don't plan ahead, but you can. it's not the disaster, but
Yeah.
the lack of preparedness that causes the most of the harm. So thank you so much, everybody. This is it from my end. Thank you. Thank you.
Thank you, Midja, for this presentation. Only one point I would like to bring to highlight at this point, because you have told that the leach pit toilets are suitable, but for flood-prone areas and high water table areas, we generally don't suggest this design.
Yeah.
There you need some additional design. So that particular highlight I will bring, and I'll come up with some questions later for you. Now let me invite Poonam to make her quick discussion, and if there is a presentation, I invite her to please come. Over to you, Poonam.
Thank you so much. See, I don't have any presentation, but
Okay.
because emergency wash is a not new subject, and I think people who are in the
I
audience, they have
think you
been
can be little more louder if possible.
okay.
Yeah,
I'm okay now.
little bit, yeah. Little bit improvement is there.
Just let me just. I think now I'm better, right?
Yeah, yeah.
Okay. So, I mean, the sector has been implementing emergency wash for years. So, I'm not going to repeat what is already been known to the people, but based on my experience in the field, I will just share some of my experiences and where I saw that gaps and how improvements can be promoted, and I can influence on those lines. So I have been given the subject on hygiene promotion and risk communication. So first of all, I think it is important to understand that why, hygiene promotion and risk communication is important, because in past what has happened that people used to go to the field, and they used to construct infrastructure and supply some items and do some hygiene education sessions and come back, But we have seen in past that those emergency wash interventions didn't create much impact on the community. And later on, it was thought that our community is not in beneficiaries, but now we treat them as a participant of the project, And therefore, the hygiene improvement framework was promoted by Sphere, and we all knew that in addition to the infrastructure, the sub-component activities, especially your education, your behavior change activities with the community engagement, and how you mobilize and create an enabling environment is also essential, along with the hard components, so that we can really improve the hygiene framework and so that we can prevent the wash triggered diseases. So coming back to risk communication, based on my experience, what I have seen in the field is that generally we go, and many of agencies I have seen that they wait for their whole supply to come, and they distribute, So in that situation, I think starting from JRNA, when we do the JRNA, at that time, definitely we need to understand the risk in terms of disease, actually, where the prevalence is there, And for that, a proper collaboration with the health department as well as the community is also important. And we also need to understand in which area the high risk cases are there, especially for the worst disease, infections as well as the probability of diseases. That is quite important, so that we can also plan during our proposal time also that what needs to be done. At that time, it's also important to have segregated data of people, men, women, children, and take their feedback that what is their concern when it comes to responding to the emergency needs. Once our project gets approved also, I think okay. Then in that also, I can see that in the field now, agencies are promoting us to that once your project is approved, do a quick, present emergency need situation, and especially for the wash, For example, I was with UNICEF last year, and we were implementing one eco project, and eco clearly stressed to us that, okay, fine, you conducted the GRNA, but once the project is approved, now it's 2 or 3 months later, kindly do a quick assessment of emergency wash requirement for the time being, and let's see whether there is a change is there regarding the needs or the supplies, So when we went to the community and we reassessed the needs, and we found that some changes are there, needs were changed after 3 months, and accordingly donor gave the feasibility to us to change the supplies, a few supplies, This is important because most of the time, because emergency is a fragile situation, we all are in a hurry and pressure is from the donor side, from the team side, as well as there is a time frame, plus there is a huge community needs, So In that situation, it's always necessary that our donor is also flexible, and we are also little bit elaborated and understand the need of the community and create an influencing system inside our ecosystem so that we can take this leverage of flexibility. Second thing is that engaging with different community groups, socially or economically or different sections strata of the community is quite important, because we have seen that initially these are the influential and the panchayat people, they come forward, and we just listen to them, but we try to forget those who are really needy, it's quite difficult, but I do understand. But definitely we are the civil society people, and we evolve, because hygiene promotion and risk communication is an evolving process. And that's why it's always recommended that you don't stop your essential needs, but stop your nice to have things, but don't stop your, for example, the water, the sanitation, and the menstrual hygiene supplies in the initial, because it's also been seen that if people stopped even distribution of chlorine tablets and they waited for months, so once their whole supply came, then they distributed the chlorine tablets, which is not recommended actually. You just distribute the immediate supply, and listen your community. There are three things. Risk communication. We all know that adults only learn when they understand why you are educating them. And this is the principle of behavior change, especially when it comes to hygiene promotion. Our people, our participant from the community, they should know that how if my behavior is ABCD, how it is going to affect my health. That communication should be properly communicated to them, and definitely we also need to listen to them, so that what is their existing practices, what are the taboos, what are the myths, and build our hygiene promotion activities and behavior change activities based on their learning level. And second thing, always do the pre and post, because again I'm telling you, emergency was an evolving thing kind of. So once we understand the community gradually, we also try to know them well, and they also try to accept us, and start trusting us. So honesty is a good policy where you try to engage with the people and they start trusting you and you start trusting to them. And this is also important to collect the epidemiology data from the PHC, local PHC and health department, because that data will really help us to understand whether the intervention that we are doing is really helping the people or not helping the people. Because it doesn't matter, we say that, oh, we have conducted these many awareness sessions, this and that, but if the data is not showing that any reduction into diarrheal diseases or other wash triggered diseases, then what is the use of? Then with the support of your community, try to see how we can readjust our hygiene promotion activities. There are three things important. One is the behavior, second is supplies, third is your menstrual and incontinence material. I have seen that we are doing all of them, but when it comes to old age people and the supplies that is required for them, I could see that that is quite missing into our emergency response thing. And we saw many old people who were having urinal problem, leakage problem. They asked us, that can you provide some pads to us also? So are we really listening from the people that what exactly they need, and try to avoid the nice to have, but to provide the essential items. Second thing, wash is quite linked with protection also. So definitely when it comes to site selection of your water points as well as the toilet sites, it's very much important to discuss with the community about their priorities of location as well as the distribution place. Um, because of course funding is limited and we all want to do more, but this is also important to understand the need of disability affected people, because accessibility is one of the aspect that we generally I mean, we write, but in practically, I have not seen much, doing. Even the types of ramps that we create, we create so steep on the ground because of budget crunch and all those kind of things, that is generally not being used in the community. So that is also quite important to understand. And regarding other things, for example, agencies now are saying that you also need to understand that create the protection mainstream indicators, as a process indicator of your activities. That okay, if you're doing some supplies distribution from A to site B to site C, what is the difference you can see in terms of people's feedback? Because it is also important to receive people's feedback, how you're performing. And community can provides a lot of feedback, if such certain systems are already in place, and we treat them with respect, and that is quite important. So that's PMQI and post distribution monitoring system should be in the place along with the PESA thing kind of thing, so that community feels like involved and protected with us in. So I will not go much, and I think we all are quite experienced people. So these are my basic experience that I observed in the field. And in addition to this, definitely the role of community-based influencer is quite important, as well as the local volunteers. Generally what we do, I have seen quite young people, they come forward as a community mobilizer, but we also need to understand that who the community listens to, how the people communicate, though they are local people, but how they communicate back to their community. That is also quite important, to have your base as a credible organization in the community. But this is important that we localize the intervention, definitely, but selection of those kind of volunteers is also important. Plus how we capacitate them is also quite, because they are our eyes and ears and voices in the community. That is also quite important. When it comes to IC materials, yes, uh, IC should be definitely localized. We all know this thing is not a new thing, but that adaptation should go gradually kind of thing. Pre-post is quite important, because now everybody is talking about evidence-based cap survey as well as the other things. So that is also quite important. The main thing, three, four things I would like to highlight here is that, are we really prepared for the current level of flood emergency and its intensity? I think we really need to revisit our capacity as an ecosystem, because what I saw, I mean, in urban areas, we know that even the rural people are more capacitated than the urban people. And this I very clearly saw in the Kachar flood during the Assam, during 2 or 3 years ago kind of thing. So definitely there should be some I mean, some studies should be done for the emergency was ecosystem, that where we are in terms of capacity, in terms of infrastructure, looking at the current scale of hydrometeorological disaster, as well as the risk of climate change. Like Mirza has already talked about the UDT and dry models and other sanitation models. So are we really thinking to promote as an action research into our project, because generally we try to, but many a times, in a hurry burry situation, oh no, we will not go, we will just only use this twin pit eco-cell latrines, but are they really functional during those days, the one question which came to Mirza is that the leach pit, no, especially for the flood situation, you promote the seed leach pit, the models are available kind of thing, where you don't contaminate the bottom of the ground, and you make a pakka structure, but side by combing is available, side combing is available. So those models are already available. But in addition to that, what next? Now government is telling that your waste is your responsibility. Are we really doing some action research during even the peace time to promote such kind of models and see their efficacy? No, we only talk during the emergency time. Okay, let's do this kind of thing. I know funding is a crunch, but we need to do some action research, especially on these lines. Plus, definitely, I will also promote the use of UDT and dry and eco-sand toilets. Plus, looking at the intensity of floods, if you see Assam, I could see places where 15 to 16 feet above water was gone. Where will your equation will go? Where will your emergency toilet will go at that time? Can't we think about SDP type of models then kind of thing, which can float and which can also people can use it, the shelters as well as the toilet models can be promoted. So I think innovation is quite needed based on the reality of emergency war sector where we are in. So with this, I will just close my voice. Thank you so much.
Thanks a lot, Poonam, for that succinct and also covering various aspects of not only risk identification but communication and also the ecosystems that are necessary for making this happen, including the way adults understand and how to interact with them. So it is so I have some questions in my mind. I'll come up with that after Kaushiki also completes her presentation. So now it is your turn, Kaushiki, and uh, I understand you are going to start with a quiz, and then you will get into some discussion. That is what I've been told. So so that would also mean all the audience who are here will have to answer some of the questions that Kaushiki has prepare. And the one other, uh, important thing is also that uh, now, like I said, I have already listed my questions for both Mirza and uh, Poonam, and I'll also have my questions for uh, Kaushiki. But all the participants here, I request all of them, if you have any questions, if you have any points, in case time permits, I would request the Steer India colleagues here to open up the discussion points, even with one or two of the participants. But let us see how time permits us. So now over to you, Kaushiki, for this, questions.
Thank you. Thanks, Raman, and really nice to see you. I was thinking that the team here is very quiet. So that's why we want to do a little quiz. And you can see the quiz right now in front of you. And I think we will start with the first question. Very simple question just to wake everyone up. So the first question is, which of the following is not a direct objective of the Health Emergency Preparedness Initiative? That's HEPI. And you have four options: building core health emergency capacities, integration of WASH and climate resilience, deployment of field hospitals during conflict, and strengthening surveillance and early warning system. So please answer the question number 1, and then we will go to the next one. And I'm seeing only one person has participated.
I myself have just entered, so probably people are entering.
No, so Raman, we are going to give you a grace marks. You have passed already in this quiz. Okay, so we are seeing some of the answers coming in. So 50% is saying building core health emergency capacity. Okay, deployment of field hospitals during conflict. 67%, and I only have 3 out of 33 participants. Okay, so the correct answer is C, and 75% of you have got it right. So we'll move to the next one, that is deployment of field hospital during conflict. That's not a part of HEPI. Again, a very simple one, which is according to the Bradley classification for WASH and emergency setting, which is the most directly associated from the following types of diseases. And we have 75% saying water-washed, water-borne disease, 13% is saying vector-borne disease, and we also have 10%, 1% saying it's vaccine-preventable disease. So I think, again, a clear winner, 80%, and that's the correct answer, which is water-washed and water-borne diseases. Now we'll go to the third question. This is asking about which of the following gaps commonly exacerbates the public health risk in humanitarian crises. Is it delayed deployment of public teams? Do you think over-communication across clusters? Weak coordination between shelter, health, and WASH sector? Excess data collected through health assessment? So there is 20% talking about delayed deployment of medical teams, and we have weak coordination between shelter. That's also coming up as a big one. And then we have the last one. Sorry, I think I have the poll has stopped for me. So it is the weak coordination between shelters and the clusters between, so I think I'll end it here because I can't see the poll. I don't know if other participants are still able to see the poll. And what I'll do is I'll quickly upload my presentation and take you over that. Yes, and there is a last one which is coming and very interesting, which is showing a mixed kind of a thing where in the context of mental health impact from climate related disaster, which is the following that represents an indirect impact of climate health on the psychological effect. That is not a direct effect, but an indirect effect. So PTSD following a flood, anxiety from displacement, loss of livelihood and identity, acute stress due to injury, and 50% is talking about loss of livelihood and identity, and 29% anxiety from displacement. So with this, I am going to share the results here, and we will now go quick over the presentation because I'm sure Raman is not going to give me extra time. So this is what I wanted to share, is that the first responder in a crisis, and that is water, sanitation, hygiene, and all the people here in the participation where we work in WASH in emergency. I just want to remind you that this is the United Nations General Assembly minutes, and it talks about the right to safe and clean drinking water and sanitation as a human right. And it is, again, our duty to provide safe, clean, accessible, and affordable drinking water and sanitation for all. Because I think this is one of the most important things that we are all working together. And of course, remembering our SDG 6 WASH-related targets, where we are looking at SDG 6, but it's also important to remember that it is not only about the WASH in communities, but what happens in emergency when WASH in healthcare facilities get affected, the WASH in schools get affected, what happens to the sustainable city and community target and the goal 11, and then what is the final target of no poverty. And when we talk about WASH, we have to talk about climate action because it is about taking these urgent action. And this is about taking the long-standing climate resilient water, sanitation, hygiene to ensure that some of these impacts are a little bit lesser. So poor WASH leads to what? Like you can see all these colorful, boxes. It talks about how children are more likely to be undernourished or stunted. It also talks about how the attendance actually drops when there is really poor WASH, exacerbated with any form of emergency. It talks about how improper disposal and treatment of wastewater is affecting, how girls and women, the vulnerable population, are getting affected, and the billions and billions of amount that we have spent already in Swachh Bharat mission and in Jal Jeevan mission, and then how a flood or a cyclone is completely taking all the, it's washing away all the money. But I also want you to focus on this one, which is the main cause of fecally transmitted infection. It is literally one of the most important example of why we need to work on WASH. Public health disease in emergencies, and we just spoke about the Bradley classification. So great round of applause because all of you know it is the water wash diseases, and this shows about the different diseases and the causes, and it's talking about the contamination of water. Let's say by the flood, it can be lack of water when there is a flood or a cyclone happening. If there is a water related and vector borne can be a cause given the amount of stagnation, especially in a flood. And then what kind of different other water-based life forms can get created. So there are these diseases and there are the causes. And again, it is compounded when we have a flood situation. Humanitarian crisis and public health risk, I think it is very important to also look at why do affected population become vulnerable to public health threats. And this is talking about in terms of any emergency, the health services are weakened or disrupted. Water and sanitation services often partially or totally disrupted. And you can see some of the photographs which is taken across the world globally and also from India. Environmental conditions sometimes make it prone to infectious disease transmission. And then finally, the lack of communication between shelter, WASH, and health cluster. And this entire coordination mechanism during the WASH and emergency makes it really difficult. And finally, poor data and information management. We do have these data, but then there are a lot of gaps that we see from time to time. But I think what we want to focus on something here, and this is a Vedic note that came in on hygiene promotion in emergencies, and I was hearing Poonam talking about these hygiene promotion. I think communities affected by a disaster and let's say flood in this situation often lack basic water and sanitation facilities, but they're likely to be traumatized and vulnerable to diseases. And such disruption is something that we need to really counter in. This is a new point that I wanted to share across this community of practice. That is, are we talking enough about the mental health impacts of climate change and the disasters that is happening so often? If we look at the direct impact, it talks about trauma. If there is a flood, if there is a loss of livelihood, we are talking about food insecurity, economic hardship. We are talking about displacement or large-scale displacement in some situation where there is a social disruption and also loss of identity. There is also indirect impact of climate change, and what it does to mental health is when we have climate change effects, it's talking about environmental degradation, and there is an ecological grief that communities are facing. When there is resource scarcity, there is social tensions, and we know it enough that when there is water scarcity or if there is a flooding, the social tensions in just acquiring the common public water and public facilities, usage of public facilities actually creates a lot of social tension. And then finally, migration and displacement, because of course people will not stay in their house when there is a flood or there is a cyclone that has happened. And this actually causes a huge impact on social and economic challenge, creating a deepened mental health impact. And I think we have to look at the vulnerable population when we are also talking about water, sanitation, hygiene in emergency, and how it is affecting children and adolescents where they are impacted and they do have very low high vulnerability. Talking about the indigenous communities where the communities are facing severe impacts and again very high vulnerability. Low income communities are the first one who is facing the brunt of wash in emergency and also the brunt of displacement, including the mental health challenge that they face. And then people with pre-existing mental health conditions, I think it's also important to see if people are already having certain conditions like anxiety, depression, then how are we also talking about it? Within the wash in emergency, is there any conversation around it? This is an interesting slide where we're talking about these long-standing protracted crises, and disaster do not always not cause outbreak. If there is a disaster, if there is a flood that is happening, we can think that there might be an outbreak, and that represents a risk. And which means that if a disease outbreak may happen, it can also happen without a disaster, but it is better to prepare. And that is the reason why you look at this map, and it is a little older map. It is taken from 2017, 2018. You see all of the cases on the left-hand side, and this is focusing on Africa, talking about the various wash crises that has happened and the kind of morbidity and mortality rates. And then if we look at the map here, which actually shows that, wherever the water, sanitation, hygiene public systems are really poor, that is where the maximum amount of public health risk has been accounted for. So it is important that we do preparedness, and that is exactly what Sphere is talking about and getting this community of practice to talk about. We have to implement the rapid wash intervention and we have to invest. Health Emergencies Preparedness Initiative. I'm going to talk very quickly through this one HEPI framework. It's basically a strategic framework where we talk about preparedness, response, and resilience. And this is looking at the health part of it. How do we tackle the health emergencies? It is basically, again, to build core health emergency capacity at all system levels, because we do a lot of work with wash and healthcare facility. I think it's important to talk about developing those emergency capacity. It is important to again integrate the infection prevention and climate resilience into the preparedness plans for the healthcare facilities, and then strengthening surveillance and early warning system, and finally enabling rapid response and recovery for clear protocol. The core components again look at surveillance and early warning. So wherever we are doing programming with the health, it's important that there is an integrated disease surveillance and closely work with them in order to understand that if there is a flood, what is going to affect. Preparedness and planning, again, all the WASH institutions, organizations, UN, we are all talking about preparedness and planning. And this is not only a silo conversation. The preparedness planning is a conversation with the government. Capacity building, critical stockpile where we make the planning, we ensure there is resources, and then finally doing this community engagement. So intersectoral linkages again for the team to think about how do we look at the IPC, how do we look at Ayushman Bharat. We can also look at the National Program on Climate Change and Human Health, and because they have very specific mandates on this interlinkages, One Health Initiative, and again, of course, Swachh Bharat Mission as the primary ministry. Finally, what we want is that if you have to ensure health within the WASH emergency, we need a coordinated, resilient health system who can also safeguard and support. This is some of the HEPI disease categories. I'm not going to go too much into it. Some of the three building block of an emergency response, this is a focus, and this is what we used to work a lot on. That is, effective response happens in three ways. Program, where you need an assessment. Operations need to be streamlined, where supply, logistics, and operation becomes the most key important partner within the organization. And finally, the coordination is very important with this interagency and with government. And at the end of the day, if you don't have preparedness, none of this actually works. And finally, for emergency response preparedness, I think the first thing will be risk analysis and monitoring. I think climate risk analysis is something that we should be looking at, given the floods and the cyclones are repeatedly happening. And there is minimum preparedness action plan, and then you have advanced preparedness action and contingency planning. And I think in terms of the resources, an organization can place themselves accordingly through this process. Finally, resources, again, humanitarian appeal for children. These are some of the indicators, which is, I think my time is up. The hack indicators, this is again something that we used to focus, and we focus very much in the hack appeal done by the UN. These are some of the indicators that is very important, again, to be monitoring. Unless we monitor these indicators, it is difficult to also understand what's the improvement. And then we also ensure that, these are some of the areas where you're doing the appeal. You're ensuring the numbers are clear, and whenever the appeal is published, then you are ensuring that, the resources come specifically for these work on these indicators. So I'm going to stop my presentation here, and I'm going to hand it back to Raman. Raman, over to you.
Yeah, thank you, Kaushiki. And several, the health emergency prepared related critical insights came. Now, let me, since, we have exactly 30 minutes to go to finish the session. So what I'm going to do is from the three presentations that I heard, I'm going to put up some quick reflections on these three presentations, and then I'll come to the speakers with some pieces of questions. I'm sorry, in between there was a description. So one, in the initial presentation, when Mirja was talking about, one, addition that I will make, there is also, because, this, when it comes to monsoons, floods, and also as Kaushiki rightly pointed out, it is not necessarily, immediately after the monsoon or immediately after the floods, the specific challenges are coming. It is because of our the systemic preparedness and the systemic gaps, where, our water systems and also health systems at times are poorly functioning. That is where, these issues are rapid, and these issues are very high. So one issue that has not come up in the larger discussion, which is important, particularly in the Indian context, wherein, if there are floods and the animal feces need to be, and the animal urine needs to be seen as a major risk. So that, the leptospirosis and related issues that can create a lot of challenges, health challenges, and, take things into a different level where the solutions are very small. It is not that we require a lot of advanced health response for that, but how to prevent that. That is where the episodes of either leptospirosis or how the animal feces and animal urine, those kinds of things are managed well in our society. That is one important element to look at. The other things, of course, I agree with what Mirja said about the elevated hand pumps. But we need to also think about now, we are moving towards, particularly in most states of India, we are moving towards functional household tap connections. In some places, there are issues about it. And in some places, the water supply is reaching homes. Uh, in most places, I should say. uh, so here it is very important that the community standpoints, how to elevate them in a way that they are not getting affected during the floods in those flood-prone areas. Or the other important thing also is that now the flood-prone areas, because of known reasons, we can map them. But it is not very easy to map them when the what do you call reasons, for example, the urban flooding phenomenon that is happening, across various cities now, including the capital city at this point in time, whether it is Delhi, whether it is Gujarat, Gurgaon. We have, several places where, the urban flooding phenomenon is very much there, even though the places are not very much flood prone, but the specific urban development has caused some of these issues. So that is something to look at. So the urban planning and also in specific places, rural planning also has something to do with this health preparedness. So when we are missing that health and well-being angle in the broader planning activity, that needs to be thought through. The other important thing is, which is about what Poonam has said, uh, is the identifying the risks. There is a location specific issue too. So one important thing is that the interagency groups and also the local level organizations has to have this capacity of uh, understanding because the textbooks and guidebooks that we can prepare will be from a national perspective, and at times it can be international perspectives. But the local perspective of each of these, things, how to prepare the capacities of people to do a localized risk assessment and to understand them in time, much before the floods or any other, the disasters can happen. And then the important thing is also to time the interventions, timing the interventions in a sense that when to do this communication. At times, we are, it is a quite known factor that because of multiple, one in our country, we have only very limited number of humanitarian focused organizations. Most of the organizations are development focused, and when there is a crisis occurs, then all of them, takes jumps into the humanitarian action. So the specialization is missing. That is one issue. The second issue is that many organizations who is into humanitarian action are not necessarily having the proper understanding of health issues, and that becomes a very superficial, kind of management of health issues. The third issue is that the promotion element is not a post-disaster issue. It needs to happen before the disasters. So how this integration of identification of risk and risk communication in the same way as Poonam said, the adult education, how to integrate the lessons and techniques of adult education into the communication. Then only we can think about when to time the promotion, who will do the promotion, what media will be used, and how the promotion activities will go. So that I think is an important point. And in all these, again, all the three presentations, what I was looking forward, and I'm going to ask all the, presenters is to also think about we are talking about the elevated what infrastructure, we are talking about the elevated health systems or, sharpened health systems. We are also talking about a stronger communication. We are talking about the roles of CSOs and all that. But what about the roles of the local governments, whether it is the municipalities, whether it is the Gram Panchayats, whether it is the second and third tier of the Panchayat Raj systems? We need to look at the roles of local governments in a much more enhanced manner. So I would like all the speakers to reflect on how the role of local governments can be enhanced into this. The other important point is about the emergency watch ecosystem, and that ecosystem, again, because we most of the time what you call set up the ecosystem only when we know about some problem is coming up or already has come up. So what is the preparedness around the wash ecosystem, and what kind of things are to be in addition to the water supply, or some of the things that is already there? What kind of additionalities are to be there, and when to time it? That is also one question about the risk that we are talking about. Again, in the material development part also, that is another critical area. Poonam said it correctly, because initially, we can focus on the broader level, and at the micro level, it's going to take time. That is true. But on the other hand, even when we are talking about vernaculars, the most affected areas are not necessarily speaking the state language even. That is one, very, very interesting thing that I have seen very recently. I was going through, some of the flood affected areas of the, Assam state, wherein, Ahamiya is not something that everyone can understand. Assamese, I mean. So what can be the local vernacular or language? How to develop that diverse linguistical approach into the communication is another critical question. Coming to the health emergency preparedness, again, that local government issue is very much there, and uh, the see, the dependency on the frontline workers is something that we all quite often see. But the frontline workers often are affected also. I don't know how many of you would have seen in the last year when the Wayanad that the erosion happened, and the Asha of that locality, she lost 6 of her family members and still was working on, supporting others. So the frontline workers most often are affected by the the frontline workers. So how, the mental health of the frontline workers, how to prepare them for a specific kind of that frontline worker capacity, and health and wellness center, capacity in the Indian context. How to, map that into the HEPI is another important aspect that we need to discuss about, in addition to the village health and sanitation committees and the local mandated institutions that we have. So I think, these are the quick things that came as reflections when I was talking to. And now, there are other questions, some, questions I hope. I was requesting people to come up with their questions. I don't, when I'm looking at the chat system, I'm not able to really go up, or is it, there is some problem with looking at it. So anyway, let me start with Mirza about this one, this role of local governments. Second, important question is also about, uh, do we have Save the Children's work? Is there any case that you can exemplify, as how this entire issue that you have listed, how this was put into practice, and what were the key challenges that the Save the Children would have faced in this process? Over to you, Manja.
Yeah, thanks, Raman. So, yeah, in terms of this importance and support of the local government, so what I observed and what I witnessed, it basically varies from state to state. So ideally, you have processes, guidelines and everything in place, and of course the support of the local government or the local missionaries, especially the panchayats, becomes so very important. But there was the difference. If you go from region to region, then I find that there is a difference. There's a difference. I don't know difference is because of the will or because of the other reasons, but there's a huge difference. I was there in the Kerala response. The situation here was somewhat very different. If you go to the Himachal, the situation is very different. So I think, as you have rightly pointed out, the local support, it's just something that we need to work on that. Because if the local support is there, if a system is well in place. So recently I was in Lahaul Spiti and also in Shimla. So we are working with the Indian, with this disaster management, and also preparing the plans for certain health facilities. So we find that there are a lot of challenges are there in terms of other things. People want to do, and they want to do it, but unfortunately the preparedness and plans are not in place. So what I felt on that, it's important that there has to be a proper preparedness. There has to be a proper sensitization, because see, guidelines are in place, system is in place, but I think it's more about the will to do it. It's about the preparedness to anticipate. Because what I feel is that we Indians become active something, but something actually comes in, we don't prepare in advance. And of course I think some kind of anticipations are not there. So I personally feel that it's very important that local bodies need to be well sensitized. Guidelines are already there. There's no point in terms of having guidelines, PPTs, thousands and numbers of trainings are going on, and people are being sensitized. But it's important that we need to look into that aspect, and see what best we can do. And of course this whole local process comes from the community awareness. As I just want to cite an example. When in 2014, when this concept of Swachh Bharat mission, it was adopted, we worked together, and there was the concept of this Swachhata Grahi and all those prereqs. So it was like a entire campaign mode, where not just the government but also the voluntary support was there. So I think that kind of I feel that kind of support and that kind of phenomena need to be inbuilt, and this is so very important. In terms of the experiences which you talks about, so I think we Save the Children, we worked a lot in of course in disasters. And I think whenever there was the disaster, Save the Children always there, whether it's flood or anything else. So we had good experiences to share with. Although in terms of having challenges, what I observed in the fact that if you have a consolidated good local support, then it's always easy to build up on that. But if you don't have that kind of support, then it will be challenging, and of course difficult. So we have associated with lots of disasters, and we provide relief, we provide certain kits, rehabilitation, nutrition kits, wash kit, PPA kit, other kind of kits, and other life-saving supports. And especially in terms of, if you see wash, we also provide a lot of support to that. So of course challenges are always there, but it's important that how you mitigate it. And then I think the most important point which you also mentioned in your presentation is to work on the localized solutions, because until and unless you don't work on the localized solutions, you will not able to mitigate the challenges and overcome the hurdles. So this is what my
Okay.
experience, sir. Thank you.
Thanks. So let me take that the localized solutions part to Poonam. So in the top-down approach of risk identification and communication to bottom-up approach of risk identification and communication, how this journey can be possible, and how would a local level capacity building for this look like? Yeah, over to you. In addition to the local government question.
So see, actually, I mean, like what Nurja has said, everything is written into our policies and plans. Very good policies and plans are already available, which even talks about even our Panchayati Raj system is a bottom-up approach. Which talks about okay, take feedbacks and then assemble and then plan kind of thing. But definitely, actually, I didn't see it in practical terms. Though a lot of talks are going on. Even last week I was in the E4C, like workshop of UNICEF, organized by UNICEF, for the children, and even the Joint Secretary, Ministry of Rural Development, he himself said each panchayat has given 25% extra budget where they can have the flexibility. Even, for example, they can choose. For example, if any panchayat which comes under any disaster prone area, they can plan 25% budget of their total income for preparedness and for long term programming. I also feel that that again I'm telling you, sir, if people are properly sensitized by us, for example, because we are the salts in between the government and their citizens, only then they will able to ask questions, and if they ask questions, only then something will change, Otherwise, we have seen so many things in terms of Swachh Bharat mission, But if you go to Assam, every year those toilets will be broken, And every year the civil society organization goes and construct toilets, and come back kind of thing. Every year we do, kind of. Similarly, even Koski was part of UNICEF, I mean, UNICEF gives these water treatment systems, What happens every year we give water treatment systems to the field 10 to 12, even other agencies are also giving those systems, And once disaster is finished, the system is also damaged, Then again we go and give to them. But if local people can be capacitated, how to repair, all those supplies that are given by government or NGOs, at least they can have a local system of operation and maintenance kind of thing. Uh, so sensitization, risk communication is also quite important. Now we are talking about imposing the this weather data to the social and economic data, So those kind of communication should also be passed to the community, and interceptions of data should also be taught to them. That what does it mean, kind of thing. So if they understand, okay, if climate change is happening, it's not affecting me directly, because our problem is that when we say flood, then we say it's a flood, it's a disaster. But those disasters are coming every day for plants and other species, changing temperature. We can see that growth of many, like, these agricultural crops are reducing, But this should be communicated properly to them, Then they will ask question. Even our panchayat will also be sensitized then, if they understand what does it mean then, and how it is affecting to them. Because human beings are very selfish, if we know that, oh, it's affecting me, then we try to take care of that. Second advocacy, sir, I also would like to do through this forum, that sphere should not limit itself only to the flood response only. Because if you see, the nature of disasters are changing in India. More than 50% India is going towards drought. And then again, water stress, that how we can link the climate change, like what Kosiki said, it's affecting the health, the other parameters, the children, the livelihood, Let's make a link between these two, okay? Because residual risk is in terms of disasters, that okay, we're not able to control through prevention and sustainable development, then the disasters can come, kind of, and then we are responding to this one. So from responding and reactive to proactive approach, now we are talking about that thing, and that will come with a continuum of prevention, sustainable development towards preparedness, kind of. This cyclic approach, I think we all need to promote this thing. And then because disaster management is a sector, I mean, that was quite blessed, I think, with the so many sphere type of networks and NDMA, NDDMA. I think with NAP also, we need to build our networking. Now people are talking about NBS solution into humanitarian response. That is climate resilient into humanitarian response. Ecosystem support for mental health, and psychosocial support
So,
kind of thing. Yes, sir.
yeah, thank you. So two very important thing is one, we have to prepare our administrators also. Some promotion needs to happen with them. And the second thing I hear from you, but that is something, today's focus, although it is on flood, Sphere India has, that larger, so continuous kind of initiative that is going on, which covers even drought. But drought is not that climate change and drought that has not reached to the level of deeper understanding in our country. And a drought is not seen from the disaster lens, but a different lens. That is also something at the community level, at the organizational level, it is seen as slightly differently. So we need to change that attitude and understanding also. Over to you, Kaushiki. And the question is, one is about the frontline workers. I told uh, how the midline workers and the professionals within the health system also can be oriented towards, because our primary health system quite often does not have the mental health capacity, and stress management and trauma management and the PTSD management. Those are very far from reality when it comes to our health system. So the disaster related, I realized this when I was working in Orissa after the 95, 97, that post super cyclone situation, wherein the health department itself was not prepared, and it was a huge task for the huge trauma that was, and the post trauma situation that we had to address them. So how would you prepare the health systems to also look at mental health issues, not just the clinical the medicine part of it, but the mental health issue also? Yeah, over to you.
Thanks, Raman. I think you've kept the most difficult question, which has not something that has been spoken enough about the mental health and its impact right now on the frontline workers. And I completely um, think that this is probably has been a gap somewhere, especially looking at the emergency and the kind of work water sanitation hygiene professionals are doing. I think on your point on that, how we capacitate the healthcare workers more, I think there is a lot of conversation where when they are creating these, healthcare facility level plans, there is a lot of these context that they are trying to put in terms of the climate resilience. Is there a risk analysis? Is that hospital in a particular area which is prone to flood? Then what is the specific action that probably that hospital or the healthcare facility in that district needs to take? So there are some of these components which is getting embedded somewhere while they are doing this healthcare facility plan. But if we look at the totality of it, it is not enough. It is not enough to say that they have the resources or the kind of let's say the continuous process set up somewhere to be able to tackle a majority of this point. So I think it's a question which I feel that we don't really have a very very direct answer. But I think taking from what my colleague Mirza and Poonam was saying, that there are these specific government departments where we are trying to involve, especially when I look at the Panchayati Raj ministry and department. There is a very strong focus where they're talking about having these preparedness plan. And when they are doing this preparedness plan, it's not only about the community, they are also including the schools and healthcare facility, and they're trying to pre-position some of these materials, or let's say the supply or the kind of planning that they need. So there is a conversation that is happening. Like Poonam is mentioning, we know that there are tight funds to water sanitation. So provisions are there, but I think recently Raman, we did this, UNICEF did this risk analysis with CW, and it was a study to identify and rank all the districts of India according to the high risk that they face in terms of water sanitation hygiene. Risk analysis has happened in terms of vulnerability mapping and seeing which state is doing how in terms of all the other aspects. But specifically, if we look at water sanitation hygiene, then what is that particular district risk score? So I think now once when we did this study, we felt that this is something that's coming up cyclical. Wherever there is a flood, though some of those districts are facing flood every time. Wherever there is a cyclone, it's becoming like a pattern these days. And I saw Poonam, you wrote that things are shifting, and we can see the climate change shift. So I think one point that we also in UNICEF we were talking about is that when we talk about the Panchayati Raj department and when we're looking at these Gram Sabhas, is there a way to do some of these local risk analysis or locally focused analysis where the healthcare facility is also engaged, the school is also engaged, and also the community people can figure out some contingency plan, because that
So I
also
think, yeah.
helps in positioning and also creating that long lasting effect. In terms of mental health, I think, Raman, this is mental health impact, climate change impact on mental health. This is something globally there is a lot of conversation, but I believe we need to also look at it in a more focused way. Maybe this community of practice, and especially for wash and emergency, how mental health is affecting, this is not a lot researched right now. We don't have a
Right.
lot of local level or let's say even state level studies that's coming out. So I think a bit more research and conversation around this line and at different platforms will be a good way to start this process.
Yeah.
So
All right.
that's all from my end.
Yeah.
Over to you,
So we are closer to the time limit. Let me just quickly highlight. Kalika is saying that Kalika Mahapatra in the comment, she's saying that the super cyclone situation was different, and now there is a lot of orientation happening with the frontline workers, particularly in mental health. It's a welcome situation. This is what I highlighted also, because in that Orissa time, it was realized and it was started, but when it comes to the all India situation and also the South Asia situation, there is a long way to go. Particularly in this aspect, including in advanced states like Kerala and those places. Second, there is one question I have highlighted that when I was talking, Debabrata Singh, highlighting this question, and he's talking about how the urban planners can come handy in spatial health risk analysis of water and vector-borne diseases and strengthening resilient wash infrastructure, especially in cities. So in this, my quick reflection too. Of course, I would have taken opinion from my panelists, but in attention to the time, the thing is that when it comes to the climate action plans, when it comes to the disaster response plan at the city level, uh, the urban planners are not really into that. This compartmentalization of master plans done by the urban planners and disaster and climate plans done by other experts, and there is no marriage between both, it's a major challenge. So when we are doing the disaster preparedness plan, we need the urban planners to look at these issues and to contribute uh, uh, technological and other kind of inputs into this process, so that some of the problems that we are facing now, at least a large proportion of those problems are foreseen and we are able to respond to that. So we can do it, provided some of the larger cities can show the way. Like, if for me, if you ask what is a smart city is smarter enough, should be smarter enough to foresee most of the problems rather than smarter in terms of digitization and all that. So I would say that, and also it is interesting to see one Sahabia doctor's comment in some of the Manipur context and all that. I would have liked to definitely ask him to reflect upon, but it is time. In case we have 2 minutes, Sanchita, I can ask him to reflect upon.
Definitely,
Yeah.
sir.
Yeah, Sahabia, would you like to, Mr. Sahabia, would you like to very quickly taking 1 or 2 minutes about what you wanted to? Okay, Miss Sahabia, sorry. You are mute. there's some problem we are facing, I guess. Yeah. We are unable to hear you.
Yeah.
So I think I'll have to, looking at the watch, I'll have to hand it over to Sanchita back now. Thanks, and I'm sorry, Ms. Sahabia, that I could not take this opinion from you. And over to you, Sanchita.
Okay, so moving forward to the vote of thanks. So, good evening, everyone. On behalf of Spare India Academy, I, Sanchita Viswas, Deputy Manager KCS, would like to extend my sincere gratitude to all of you for joining today's insightful webinar on WASH and epidemics, preventing waterborne outbreak during monsoon floods. So your participation and engagement has made this discussion truly meaningful. In the face of increasing monsoon-related health challenges, your dedication to knowledge sharing and collaboration is more important than ever. A heartfelt thanks to our expert speakers, Mirza Sir, Poonam Ma'am, Kaushiki Ma'am, for their thought-provoking presentations, to all those who contributed to a dynamic exchange of ideas around WASH system, epidemic prevention, and community preparedness. A special word of appreciation to Raman sir for his excellent moderation, your steady guidance and ability to weave together a very diverse perspective help navigate the conversation with clarity and purpose. To all the participants, health professionals, disaster risk practitioners, WASH experts, and thank you for taking the time out and be a part of such a critical conversation. Your presence today reinforces growing momentum for building a resilient, informed, and a responsive community. We look forward for a continuous participation in upcoming webinars under Spare India Academy, where we aim to address key themes like public health, disaster risk management, and other humanitarian response sectors. Please stay connected with us through the platform and share your feedback to help us improve the future sessions. Stay safe, stay resilient. Thank you once again for being with us.
Thank you. Thank you so much. Thank you.
Thank you. Bye-bye.
Thank you.
Bye,
Bye.
everyone. Take care.
Thank you. Bye-bye.